Hello, everybody, and welcome to this edition of Let's Talk, presented by the Visiting Nurse and Hospice for Vermont and New Hampshire. I'm your host, Anthony Knox, and I'm the Community Relations Manager for the Visiting Nurse and Hospice for Vermont and New Hampshire. And today, our presentation is going to be talking about our maternal child health program. And this is a program that a lot of people aren't aware of with the Visiting Nurse and Hospice, specifically because it's a program that focuses on children, and that's not necessarily something that you think of when you think of the VNH. So, but I am joined today with the Director of the Maternal Child Health Program, Stephanie Mozzer. Stephanie, please introduce yourself a little bit further, kind of give us a little bit of background of what brought you to the VNH.
Hi, Anthony. Thanks for having me with you today. So I am the director of the Maternal Child Health Program at the VNH. I came to VNH because I had a history of working in maternal child health programs and was brought to that through care that my children received when they were infants. And so I was not aware of what the work of home health nurses was until I needed them. And so that prompted me to go back to nursing school and work in the home health field. And I was excited to come to the VNH because of the connection to the Dartmouth health system. And so I've been with the VNH for just over 3.5 years, and I'm excited to share the various programs that we have available.
That's awesome. I mean, that's a great story, and really it really explains as to what led you to being a part of the VNH's maternal child health program. So we are going to dive right in and. So Stephanie, take it away and tell us all about the program.
Yes, our maternal child health program serves mothers, pregnant people, children, babies throughout the eastern side of Vermont and the southeastern side of Vermont and southwestern side of New Hampshire. And the programs that we offer in both states include the skilled nursing services for a maternal and pediatric population. And the state of Vermont services that we can offer are the pediatric high-tech nursing, the Strong Families Vermont Sustained Home Visiting Program, and the Pediatric Palliative Care Program. So I wanted to share a little bit about the skilled nursing program. So this is the way that I was initially introduced to home visiting as a new mom. The patients that have high-risk conditions or medical conditions requiring further education and frequent visits can receive a doctor's order to be seen in the home by a nurse. And so we can visit people prenatally when they do have high-risk pregnancies. We can see someone that is postpartum who might have a history of high blood pressure, a blood clot, diabetes, postpartum hemorrhage. So there are a number of reasons that we can see people. Also breastfeeding challenges. Our staff are certified lactation counselors, and they have this provides them an additional level of education for breastfeeding, and so they are able to assist in those early days when someone is establishing breastfeeding, or if they are trying to ensure their child's gaining weight with feeding them formula. So we do educate on both breastfeeding and formula feeding. We do infant infant weight checks if there is concern about feeding or there is concern about growth. We can see children of all ages after they've had a hospitalization and provide that reinforcement of the education they received in the hospital. So that is another thing that we can do. And at times we do support families who have children with cancer diagnosis. We support them through education, and we also support them with doing in-home lab draws. So I know in the past we've been able to help families so that they did not have to travel to Boston as frequently. And so again, it's a really convenient service that we can provide to keep families in the home and ensure that they are getting the care and the education that they need.
Excellent. So Stephanie, one question about the skilled nursing. So
Sure.
obviously the VNH does skilled nursing for adults. That's a primary focus of our home health services that we provide. Is there a difference in that skilled nursing from that adult perspective that for new mothers that is the nurses that are working within the MCH program are just more are I don't want to say better trained, but are trained specifically because it's working with a new mother versus somebody who may be experiencing those same types of medical conditions, but didn't just give birth?
That's a really great question, Anthony. Yes, our team of nurses has specialized training and education in the various conditions, the population that they're serving. So while a home health nurse would be able to visit a postpartum mother who might have a wound or might have a high blood pressure, they can definitely manage those situations. They might not have the level or the expertise that our MCH staff has, because they do see this is the population that they serve, and they do have specialized knowledge that can help them answer those questions about being in a postpartum period, whether it be feeding or sleep or nutrition. So there are, there is a specialized knowledge that our nurses have.
Excellent.
So the next program that I want to talk about is this Strong Family Sustained Home Visiting Program. And this is a program that exists in the state of Vermont, which it comes down through the Department of Children and Families and works through the Children's Integrated Services. So throughout the state of Vermont, there is a very strong system approach to providing care to children, young children, and their families. And there is an umbrella of services that are available in the communities throughout Vermont under this umbrella called Strong Families Vermont. And one of the programs that is available is the Strong Families Sustained Nurse Home Visiting Program. And this program, while it falls under the umbrella of the CIS team in the community, the nurses do work for the visiting nurses. And so this program gives us a very unique opportunity to collaborate with the Children's Integrated Services and various community organizations The program does provide a nurse to a pregnant or postpartum person. They can be enrolled in the program until the child reaches the age of 2. And so the criteria which exists for this program is that someone must be enrolled before the 6-week postpartum period. The goal is to definitely have them enrolled during pregnancy so that they can work with a nurse on really learning about having a healthy pregnancy, about what to expect when they deliver, and how to plan for a baby, and then the nurse has an established relationship with them. So when they come home from the hospital, it's a familiar face that they're able to see. The Strong Families program is able to provide a curriculum to all the participants. It's an evidence-based curriculum, so there's been studies to show that it can improve both maternal and pediatric outcomes. It helps families with the transition to parenthood. It focuses on the well-being of both the parent and the child, and it helps that primary caregiver. I mentioned mom, but it could actually be another parent or a caregiver that does enroll in the program. That is something that we're starting to see now, and so it helps that primary caregiver set goals for themselves over the course of the 2+ year period that they are working with the nurse home visitor. So it is a very goal-oriented program, but it does provide some standard curriculum around health and mental well-being and parenting a new infant and child as they develop, and then also really growth and development. So they're assisting and monitoring that process while they are in the home.
Excellent.
So what I'd like to do, this is just a wonderful program, and we have a testimony to this program from one of our Strong Families clients, Brittany. So I'd like to be able to share that.
Absolutely. So let me, Stephanie and I are going to disappear, and a pre-recorded me is going to show up. So one sec. To talk about her experience, hers and Wilder's experience in the MCH program and the Strong Families program. So, welcome Brittany and welcome Wilder.
Thank you.
And so just Brittany, for those watching at home, why don't you just give us a little bit of background, where you're from, and how did you get connected with the Strong Families program?
Yeah, so I'm from technically Landgrove, Vermont. It's a really tiny town. And I got connected right after Wilder was born. I was feeling kind of overwhelmed with being a new mom and trying to figure out everything. So they put me in touch. So I had somebody that could answer my questions or just kind of help me figure things out. Give me kind of somebody for me to rely on when I got stressed out.
Perfect. And so, and how did you find out about the Strong Families program?
I think it was the OBGYN at the hospital who told me about it.
And which hospital?
Southwest, SVMC, Southwestern Vermont Medical Center.
Okay. All right. Perfect. And how was the process of getting getting these services? You know, what steps did you have to take to enroll in the Strong Families program?
It was super easy. The OBGYN put me in touch with the social worker at the hospital, who then passed on my name to the nurse for Strong Families, and she literally just called me and we talked on the phone once and then set up her first at-home visit.
Awesome. And being a new mom with Wilder, who it may just now be the star of this entire video presentation. I mean, did you have any reservations about enrolling in the Strong Families program? Any I guess negative thoughts about seeking this extra assistance?
I guess not a lot. I was a little worried just because I wasn't sure if there was like stigma attached, or like, it's not like I couldn't afford to go to the doctors or something like that. So I didn't want to be taking resources from somebody else who needed them. But overall, they've been super supportive, and I've kind of realized that anyone can take part in the program. It doesn't have like a specific like group that it goes for, if that makes sense.
Okay, yeah, no, and that's perfect. And I think hearing firsthand accounts of people becoming a part of the program and just kind of any feelings that they may have related to it and things like that, it is important for anybody else who may be interested in joining the program. And with that, after having the conversations and things like that, was there a specific reason why you chose to fully enroll in the program and start the program?
It kind of changed over time. In the very beginning, it was literally just because I felt like I had a million questions. I was very anxious about being a mom, and knowing that someone would come in and like check with me weekly in the beginning, and I could ask those questions without having to bother the doctor every 2 minutes was huge. And then at around 2 months, Wilder started having some health issues. It turns out he's allergic to dairy and soy, but we didn't know we didn't know what was going on. He was failure to thrive. We couldn't get him to gain weight. He was throwing up. So we were in the hospital for 2 weeks. And then after that, knowing that somebody would come do a weight check on him, because they always brought their scale, was huge, because we needed to make sure he was gaining weight and that he was keeping it up after we were in the hospital. Because getting over that 9-pound hump, I didn't think we were ever going to see 9 pounds.
Gotcha. Okay. And so now let's talk about prior to fully starting the program. And so, like you said, you had a conversation prior to somebody coming out to the house, and I'm assuming finishing the intake process and dotting the T's, crossing the I's kind of stuff, and being able to get you fully enrolled in the program. So when you, prior to doing anything in the program, kind of what were your thoughts and assumptions of what the program was going to be?
I guess it's a lot more fluid than I expected. Like, I wasn't sure if like the nurse would come here and like, have an agenda, like this is exactly what we're going to talk about. These are the steps we're going to take. And it's a lot more of a conversation. Obviously in the very beginning, like I had to fill out all the paperwork and we had to go over like specifics, but now it's more, she can come and kind of answer whatever questions I have, talk about whatever's going on in his life right now, whether we're working on crawling and we can, talk about that process and baby proofing, or whether I'm worried about what he's eating and we need to talk about that. So I guess it's a lot more fluid than I would have expected, which is really nice.
Nice. And so it's more what you and Wilder need at this point versus some sort of strict curriculum that you need to follow and things like that.
Exactly, because I felt like I'd already read all the parenting books or like seen all the videos, and I actually worked in daycare for 3 years. So I already knew like, the broad overview of how to parent. I didn't feel like I needed somebody to like take me through a curriculum, but I had specific questions that pertained to our situation, and I was able to get more help with that.
Yes. And so you truly, you came to the realization that the program, while Strong Families is a program that is recognized in a few states and things like that, and that it has kind of areas to focus on and things like that, you were able to find that it became very specific to your situation, to Wilder's situation, and that it wasn't it wasn't so rigid related to that.
Exactly. Like they always bring like the handouts and stuff and we like touch on, whatever we're supposed to be touching on that time. But, if it's something that I want to talk more about, we can talk more about it. If I'm like, oh yeah, I kind of already understand this, then we can kind of just move on through that.
Nice. And so, are you still enrolled in the Strong Families program?
Yep. Nice. Yeah, they're coming about once a month now.
Okay. So, and has that, time frame fluctuated since the start? I mean, were they coming more at the beginning and now it's just because it's a little more stable?
Yeah, exactly.
Okay.
They were coming like once a week. Now it's like once a month. I think there's like a recommended time from what they've told me, but they kind of do it based on, whatever I need / my own schedule and when I can have somebody come. Especially like when in the beginning, I wasn't working, I was on maternity leave. And now that I'm back to work, they were able to work around my schedule, which is nice.
Awesome. And so, so somebody comes into the home once a month and what sort of interaction occurs outside of those monthly home visits? I mean, is it phone calls, emails,
mostly texting. Like if I have a question, they're always super easy to, super helpful with responding. And at one point, the nurse that came switched because she was training a nurse in my area and then she was trained fully. But if I have a question that my nurse doesn't know the answer to, she texts the other one and then one of the, so, I kind of have a little network that I can use. Awesome.
And so with the program, I mean, I'm assuming that there are, homework, quote unquote, that you and Wilder, need to do in between home visits and things like that. And just, kind of, what does that look like as far as like, these are the things to work on and things like that? Or is it more just based on what happened during that home visit? It's like, work on this stuff over the next month, kind of stuff.
Yeah. I mean, I wouldn't say it's particularly homework, but like, they'll give me a handout with like different activities and stuff you can try with your kid, at this age, or, ways to help kids with grasping or stuff like that. And then it gives me some ideas to go off of, because sometimes I'm like, okay, what are we going to do today? Like we have a whole day ahead with a 9-month-old. So having those type of activities, knowing that I'm able to use them to help him further his development is really nice.
That's awesome. And then, so overall, it seems as though you are, very happy with, being a part of the Strong Families program. And are there specific things that you think are just great about the program? And are there things that, potentially could use some improvement?
Yeah. I mean, it's specifically, I guess the medical insight and stuff is super helpful, like being able to bring a scale and do a weigh-in, and they keep track on like on an app of his growth percentile and everything, so we can watch it with all the health issues he's had. That's been super helpful. And also he's doing some physical therapy and occupational therapy, and they were able to help me get in touch with those resources, which I wouldn't have really known how to go about finding otherwise.
Yep.
So I'd say those are definitely like highlights for me. In terms of ways to improve, I don't even know if this would be possible. I'm just thinking, but if there was any sort of community aspect that could be, like, I know there's another family in town that is a Strong family, just because we plan our visit. My nurse plans our visits on the same day when she's in the area, but like, I have no idea who they are. And I know like HIPAA and everything gets involved. But it would be really cool if there was a way for them to like arrange like, play groups or that type of thing, just to meet other people for the community and the relationship building.
Gotcha. Okay. That's actually a great idea. And there, maybe a way to somehow make that happen. And this could be the catalyst for that. And then obviously anybody, watching this video, having questions about the Strong Families program, what sort of, guidance, advice, wisdom would you give to anybody, thinking about this program, maybe thinking that they need some additional supports? What sort of advice would you give to the next person who's thinking about this?
I would just advise them to ask questions, to go into it with lots of questions and be willing to ask them. because whether strong families, like specifically having a nurse come helps you is what you need, or if they can help put you in touch with people like an occupational therapist or other programs that the nurses were able to help me find. So just kind of going in and thinking about what you need. And also that just knowing that there's not like a stigma attached, and they're very like accepting of whatever your lifestyle is, whatever parenting choices you're making, like they're there to like help support you, not to like judge you for whatever you're doing.
Nice. Excellent. And so before we close and Wilder maybe has a chance to go, play a little bit more, any other closing thoughts about, your experience in the Strong Families program, just the program in general, anything that people should know or, think about or anything like that?
I would just say that I'd recommend it to like honestly anybody, like whether you feel like you know nothing about parenting or whether you feel like you're a parenting expert. I feel like anyone could benefit from it because there's always more to learn and new ideas, and just having somebody to talk to about it all is super helpful. So I honestly think anyone could benefit from it. Awesome.
And Wilder, do you also agree with that?
Right? You like it when she comes and plays with you? Yeah.
Well, Brittany and Wilder, thank you both so much for being a part of this presentation, and good luck with Wilder and especially those allergies, which it seems like there's dairy or soy in everything, so that must be just a great adventure for you guys.
Yeah.
But again, thank you so much for being a part of this, and good luck with the rest of the program.
Great, thank you.
All right, so we are back, and actually, so one of the things that Brittany had mentioned off camera that we just didn't get a part of the video, she had explained that the Strong Families team that she's working with has also been able to help her with getting the right formula for Wilder that doesn't have dairy, doesn't have soy in it, and things like that. So that was a huge thing that she wanted to say on camera, but we had already stopped recording. So I just wanted to throw that in there real quick.
Yeah, thank you. Brittany she did a wonderful job talking about the program, and I just want to review a few of the things that she did say. So yes, this program, it could be a wonderful match for a lot of people. I will mention there are some income requirements, but we find that many of the people that are interested are able to participate. So it is easy to sign up, like Brittany said. We can receive referrals from individuals themselves. We receive referrals from doctors' offices, and we work with the CIS teams throughout our region. So I wanted to just highlight who those CIS teams are. There is, starting in the north, the Orange County Parent-Child Center. In Hartford, there is the Family Place, the Springfield Parent-Child Center in Springfield, and in Brattleboro, the Winston Prouty Center. And so referrals can go to them if you are interested. And of course, we receive referrals through WIC and through a number of doctors' offices. So there is no wrong door for sending a referral or inquiring about the program. And I think one of the really great things that Brittany highlighted was that there is flexibility within the program. So you heard a little bit about the curriculum that was being provided, but there is that just a wide range of things that the nurse can assist with. So you heard about the formula assistance, and so the nurses might collaborate with the WIC department, or they might work with the PCP, so the baby's doctor or specialist, to make sure that they're getting what they need. But there are other goals that families have set for themselves, whether it be getting a permit to drive, a license to drive, continuing education. So whether it be completing a high school diploma or starting in college or continuing in college, those are goals that our nurses have worked with families on. And we also do assist or get families connected to housing supports if they are in need of additional or improved housing. And so there really is no limit to what work could be done in the partnership between the nurse and the family. And I think that's one of the really wonderful things about this program.
Awesome. Yeah, no, I mean, it seems like Brittany was really enjoying the program, and I mean, based on that video alone, it looks like Wilder is thriving, and I imagine a big part of that is the support that Brittany's getting from the Strong Families program. So that's wonderful. So let's bring back the presentation and dive into the next category.
Sure. The next program that we have is the Pediatric Palliative Care Program. Again, this program is for Vermont residents, and it is for anyone who is, and for any child under the age of 21 who has a life-limiting diagnosis. So there is an application referral form that needs to be completed for this program. It does require a doctor's order to say that somebody does qualify for this program. What I have seen is that this program can provide amazing support to families. And I have listed on this slide a variety of services that can be received. And so I will just highlight a couple of them. At our agency, the nursing support is one of the most prevalent supports that is given, and that's really support around care coordination. So we know that families with children with complex medical needs or diagnosis are many times the expert in their child's care. There are times when we have referrals for children that might have a new cancer diagnosis, and that might be a little bit different, but even with that situation, parents are always the experts with their child and what their needs are. And so the nurses can assist with care coordination if that is a need of the families. And so sometimes we find that there are families that might be the expert in navigating systems because they've been doing it for a dozen years, but they might have a certain need, and sometimes that having the nurse involved and having the nurse make the phone calls can make the difference in getting the family what they need. And so along with that care coordination, they can also provide education. And so whether it be a new diagnosis, a new medication, they are assisting with helping the family to really understand what they need to for the care of their child. The second most frequently used service is our expressive therapist, our child life therapist, child life specialist. So we have Andy on staff, and she has been really integral for this program, really important to support families with a variety of things. And I think there's a lot of flexibility with what she is able to do, but as a child life specialist, she's working with children to be comfortable with any sort of medical condition, medical procedures that they are going to need to partake in. And so for some families, it means bringing a teddy bear with the blood pressure cuff or whatever other medical tools are needed to really get that child comfortable with the care that they are going to need. She has worked with other children on creating art. She's worked with families in creating art and remembrance art for their scrapbook and their memory. If the child does have if the child does happen to die, or if they're or she has worked with families in creating memory boxes after a child has died. So she is a great support to families that are grieving. She has been present for a number of funerals to support the children, whether it be siblings or family members who have lost the loved one, whether it be a cousin or a grandparent. The pediatric palliative care services do allow that the bereavement services to be offered to the family as a whole, so whoever is considered that family unit. So in some cases that can be extended family. And then the last therapy that we do offer is music therapy. And we did start this during COVID. It is a telehealth option. And so we are very excited to be able to provide music therapy as a service, and that can be for the child's benefit, but it can also be a really important tool for creating a bond between a sibling or even the parent. And so our music therapists do work with families and create an individualized plan about what the benefits of the music therapy will be, and again, that varies by family, so it's very unique. But this is definitely a program that can provide those extra supports to a family that might be feeling as if they are at a point where they want to bring in extra hands. And again, these services happen in the home, with the exception of the music therapy.
Okay. That's awesome. And so similarly to, we were talking about home health and the specific training and supports that are provided based on the fact that we're dealing with children and mothers who just had a child. The pediatric palliative care program is similar in that same respect, that they're more trained to work with this population versus potentially our specific hospice team working with this population.
Yeah, the staff that does this work is very familiar with pediatrics, whereas the hospice team works primarily with adults, and so that is the main difference. Our nurses do have a specialized training that they are required to take when caring for patients in the pediatric palliative care program. And the state does support with continued education for the nurses that are active in this program.
Great, perfect.
The last program that I will talk about is the Pediatric High-Tech Nursing Program. And this program is in the state of, it is in the state of Vermont. I do believe they also have it available for kids in New Hampshire, but the services that we have provided have been primarily in Vermont. And really the importance of this program is to provide in-home nursing care to children who might otherwise be in a facility. And these children are dependent upon technology, so they might be on event at home, and so the nurses that we have for this program are really specific to working with one family, and will spend time in the family's home providing care for a shift. So instead of doing that shift work in the hospital, it is in the home. It's a wonderful benefit to the child and the family to be able to provide support to the family in the home where they most of the time want to be, and so it's a wonderful option that we have.
Awesome.
So the next thing that I wanted to share are really just all of the various educational topics that may be discussed in a variety of programs. As maternal child health nurses, we are talking about home safety and safe sleep. We are discussing and monitoring child development. We're explaining when to contact the doctor or emergency services, reinforcing what to do if someone is sick, discussing education for both mom and the child, discussing bonding, mental health, depression, anxiety, and resources for those. We can discuss medications and any contraindications or side effects, and that includes contraception and then talking about sexually transmitted diseases, lead testing, smoke. I'm kind of going out of order here. Smoking, drinking, marijuana, any other substance use. We can discuss that and connect people to resources. We do often visit babies that have been exposed to substances in utero that cause them to experience symptoms following delivery. And so sometimes those children are hospitalized a little bit longer, a few days longer, so that their symptoms can be monitored, and our nurses will go into the home and continue that monitoring and continue education around symptom management. So that's another piece of the work that we do. And then also just talking about the importance of oral health, because it's important to discuss that for both moms and for children, and we know that that's connected to our physical health. And so these are just a variety of topics that may come up in conversation at any of our visits. Of course, it's certainly not limited to this list, but just shows that there are a variety of topics that our nurses are prepared to speak about and can educate people further about.
Awesome. Yeah, that's a very comprehensive list of different educational topics that could be discussed as a part of all of the different supports that are provided by the MCH program. But I like you said, that random thing is going to come up, and the fact that the MCH program can still provide support or help coordinate resources is going to be the key.
Yeah, absolutely.
Awesome.
I have one last slide, and this one is just, I believe this with everything that I am, it takes a village to raise a child. I know that I was the new mom who didn't want to ask for help. I was always proud to do things on my own, and my life circumstances were such that I really required a village around me, and that started with the home health nurses. And so I think it is really important to just emphasize that that the nurses are here for a variety of reasons, and they can connect, they can help build that village for the families that we work with.
Awesome. All right, and that's the end of the PowerPoint presentation. Stephanie, is there any additional information that you just want to make sure that you relay as it relates to the maternal child health program, or any words of wisdom for those seeking out this program or anything like that?
I think the words of Brittany were really great, and just saying that the program is for anyone, and I'll expand that to if you think that you have questions, or if you're curious, you can always call and ask and get more information. If you think that you would like assistance, we probably could find a program that would work for you. So if it's not a VNH program, we probably know someone in the community that has a program that we can get you connected with. And I think that's, again, it goes back to that village. Like, we are working with a variety of community organizations. There is a lot of good work that is happening for children and their families, and so I know I speak for myself, and I probably speak for all the other organizations. If you're curious, please reach out, whether it be a phone call or an email. We are here to help, and we will get you connected to what you need.
Awesome. Yeah. And so if there are any questions, or need to know how to reach out to the VNH, you can go to our website, vnhcare.org, and under the programs tab there's a link to the maternal child health program, and it will give you all the information you need to be able to reach out, and if nothing else, just have a conversation and kind of determine what's going to work best for you, and if the VNH isn't the right spot, we'll help you get to the right spot. So, Stephanie, thank you so much for doing this presentation and talking about the maternal child health program. And for those watching live, I thank you for watching live, and those watching after the fact, I also thank you for joining us today.
Thank you very much, Anthony. I really appreciate being able to share the programs that we have at the VNH, and again, the expertise of our nurses. I think they do help a lot of families. So thank you for bringing light to that.
Awesome. Thank you so much. And And just keep doing the great work that you and your team are doing.
Thank you.